Hope I'm audible. Just a confirmation from your side.
Yes, sir. Yes, sir.
All right, great. So wonderful, wonderful explanations and clarities given by all the speakers before me, especially Abul sir, Jailal sir, Geeta ma'am, and all the other speakers who have spoken before me. I would like to start with a parallel with the COVID-19 pandemic. Like it's amid the vehement vaccine and waning of the COVID-19 pandemic, we have seen the medical students of this country are engulfed in yet another epidemic, which is the chaos of next epidemic. And as vehement as the COVID pandemic was, the medical profession of this country has conquered it. And so for sure, they will conquer the chaos of next epidemic as well. But the question remains why? The biggest answer that is put forth is regarding uniformity in the medical education, which I think we have been discussing time and again. However, this brings me to a fundamental question before answering that one. Are there the inputs in the medical education uniform enough to test the uniform outcomes of the medical college? Now, before answering this question, it looks to me a bit premature to go on and test the uniform outcomes when we have not made enough attempts to uniform the inputs that we are giving into the medical education, be it in the terms of infrastructure, be it in the terms of the medical faculty, the teaching faculty that is available, be it in terms of the consultants who are available in the medical college, be it in terms of the bed to the teachers ratio or the students to the teachers ratio that is available in the college. Again, it brings us to another important uh, question here. What about the unconstitutional iniquity that this exam is going to bring in? Because as we have just mentioned that not all students are receiving uniform quality of infrastructure, uniform quality of teaching faculty is available, uniform quality of facilities that are available to them. It starts from right from the canteen that they eat in to the kind of clinic that they're going to attend, because it depends on how many consultants are available within the teaching facility to actually take their clinical classes to provide this uniform quality of teaching. So there is no attempt there. So how do we go on and start comparing the outcomes, start bringing about understanding the uniformity of outcomes when we have not made enough attempts to ensure the uniformity of the inputs in the medical education? Do we really have unlimited attempts? Time and again in the draft, if you read, it mentions about the students will have no limit on the number of attempts. However, you have to pass your next one and next two within 10 years of passing of joining your MBBS course. So if you join in the year of 2024, by 2034 you are supposed to clear your next one and next two. Now let's try to also understand that from the joining of the MBBS course, okay, not from the first time that you are eligible for the next one. It is from the joining of your MBBS course. So if you join in 2024, you have to clear both next one and next two by 2034. And even if you don't want to go ahead for your post graduation, or if you want to just be a general practitioner, or you want to go somewhere, you want to practice in your village or something like that, you still have to qualify these exams, because otherwise you may get a degree if at all the amendments come from the UGC Act and the Indian Degrees Act. If they come forth, and if the university still goes on, gives you the degree on the basis of the exam that some other board has conducted for you, still the question remains, why do I have to give this uh, exam? I mean, if I'm no longer interested in pursuing my post graduation, India in itself requires more numbers of general practitioners, family medicine experts, as compared to the highly specialized cadre of medical profession. While both of these cadres are equally important, considering the fact that most of our patients will require care that can be provided by general practitioner, considering the population that we are catering to, is it a wise move to again go towards an exam which has a very skewed kind of focus on clinical subjects? That remains a question. Again, there are some more what I will say is that this basic context brings me to certain key gaps and challenges which I wish to put forth in front of this esteemed battery of of speakers here and the vigilant attendees of today's session. First and foremost is, what about the training of teachers? Geeta ma'am has rightly put forth, Jaila also spoke on it. Almost all the faculty have touched on this point. We have seen that there has been a very fancy proposition to supposedly improve the quality of doctors by bringing in competency based medical education. uh, but when we talk about competency based medical education, how many faculty in the country right now are confident in teaching competency based medical education? Unfortunately, at a lot of places, what we have seen that is practiced, that has been noted by the students, is that the same textbook has just been divided into competency based objectives. So there's nothing new about it. So you are just reading the same text under different headings, because now it has become one of the competencies. But if you look at the Miller's pyramid, it doesn't just focus on the knows and the knows how, it also focuses on the shows and the shows how, which is an important component of the existing method of evaluation of the medical profession. How do we exactly incorporate that during by using NEXT? Because we are going to rely absolutely on either a single best answer or multiple best answers as proposed in the draft. It can be a single best answer or multiple best answers that are possible in the multiple choice questions. How do we basically assess this kind of understanding of the subject based on MCQs? That remains a challenge. As put forth, if we are talking about uniform outcomes, we also need to think about uniform infrastructure, uniform teaching faculty. Can we, in our sane minds, compare the skill labs, which actually all the medical colleges are supposed to have? Can we compare a skill lab in the government medical college with that in the AIIMS? Can we compare that? Can we compare the same skill lab that is available in the government medical college, AIIMS, and some another deemed university? Can we compare the skill labs existing in different government medical colleges and different AIIMS in itself? So when there is no uniformity or no attempt to ensure that such uniformity exists across the country, why we are behind testing the uniformity of the outcomes? That remains a question. It seems to us as a glaring reality. We are looking at a government or the move by the government that instead of taking the responsibility to improvise these structural gaps in medical education, which comes in form of the infrastructure, the beds, the teachers that are available, qualified teachers, as mentioned by one of the speakers earlier. Teaching itself is a profession, but how much of the effort have we trained all the medical teachers in this country uh, in different courses that make them the different workshops that make them better medical teachers? Not really. And if so, have we ensured the uniformity of such trainings? Not at all. So instead of taking the responsibility to improvise the structural gaps in the medical education, government has found an easy quick fix by testing the uniformization of the outcome without so much of the focus in the uniformization of the input in terms of the infrastructure and the faculty and the skill labs and number of other things that is being proposed in the guidelines. But we know how much of that is actually existing in the field, and even if it is existing, how much of that is uniform. It also makes me believe that it is an unnecessary exam to stagger the pace of doctors coming out in this country, and it will again lead to facilitation of different coaching predators who will try to again now capture the MBBS students very early, right from their first years, probably the first day of their medical school, to start preparing for the next one, which to me looks further deteriorating than to improvise the medical education. So while the move is welcome, you have brought the NEXT. While the move is welcome, while it seems that the agenda is about or the intention is about bringing the uniformization in the medical education, it still feels that there is a very significant amount of gap in the attention to the details that has been put in while generating the draft for NEXT. It also makes me believe that the current proposition of NEXT is killing the analytical understanding of the subject, and we are tending to create algorithm based robots. So let's just take an example. Okay, I'm a person from community medicine. I'm working with WH as an epidemiologist. Like I'm a medical consultant. So let me take that aspect into evaluation. A very basic question like critically evaluate that India is a nation within nations. What are the implications of this on the health policy planning in the country? How can I replace this question with an MCQ? Is it even possible to capture that kind of analytical approach? Is it even possible distantly to capture that kind of critical understanding of certain areas within a subject? I don't see so. How can we integrate 10% of subject like maybe community medicine to each of these clinical subjects? Uh, so how that is going to work out, I don't understand. So if you're just going to put the program that works in the disease, that doesn't make you competent enough in the subject. So that again is a question mark. So are we just trying to create algorithm based robots? Okay, if there is A, do B. If there is B and C, do D. If there is D is absent, do F or E. Like, what kind of doctors are we creating? Where is the scope for assessing that analytical approach of a doctor in this assessment scheme that is proposed? And the last question that comes to me is that it feels that it is yet another fancy proposition, just like CBME that was introduced with no genuine thought into the implementation of the process. CBME is a wonderful idea, but on the field, if you go and see, there are significant gaps. The teachers, they just know the competencies, they don't know how exactly to assess it. We are talking about OSCE. OSCE has become such a mundane ritual in the medical colleges that the student will already have that 10 steps beforehand, before the exam, and he or she, without even understanding what that step is, will just do something around that step, and we start feeling that okay, we are doing OSCE. But that level of rigor still needs to be instilled within our teaching faculty as well as the students, to make them understand what the purpose of OSCE is. And that kind of thing needs that training of trainers. That kind of thing requires time to create that adequate infrastructure and training facilities so that we can facilitate the assessment of students in those areas. Finally, Dr. Hariharan sir has very beautifully compared our exam with the developed countries, an exam like USMLE, which is the most similar exam as he has proposed. And I cannot help but see NEXT in light of a very sad attempt to mimic the exam pattern of the developed countries without mimicking any of the efforts that these developed countries have put in teaching or training their teaching faculties, in creating absolutely fantastic infrastructure for the medical students. There, that kind of mimicking is not happening, but we want to mimic the licentiate exam, and as very rightly put forth by Jailal sir, in its given form, or the current meagerness of the details that the proposal for next that it provides, it is impossible for it to be at par with international exams like USMLE or PLAB, or Australian licensing, anything you say. It's very difficult to put it at par with such exams, which has a lot of different components. Next is also compromising a lot on the formative assessment. It is basing everything on a single summative assessment, which will decide whether you get the license or not. So there are all these glaring issues that I think are the practical challenges and practical issues that will require a lot more thought than what this 9-page draft of next proposition has come forth. And I think it's a wonderful opportunity, and I thank this entire team of IMA, MSN, and JDN to create this platform for further